Good day, everybody. My name is Leona. I work as the Director of Research within the First Nations Health and Social Secretariat of Manitoba. Also like to introduce you spiritually. Dances Gitabiasus, Gwanasigas, and Mangindodam, Isuswasis, Donji. I'd like to introduce my colleague, Dr. Alan Katz. Let him introduce himself.
Hi everyone, I'm Alan Katz. I'm a family physician and the director of the Manitoba Centre for Health Policy at the University of Manitoba in Winnipeg, Canada.
So today we're here to talk about our relationship around ethical relationships using data linkages and considerations to consider while working with one another. So on behalf of our organization, just to give you a brief background, we're a health and social entity that's been established by Chiefs Assembly since 2013. Back in the 1990s, the Assembly of Manitoba Chiefs and First Nations leadership saw the need for oversight and governance over information, data and research. So they essentially established our own First Nations REB called the Health Information Research Governance Committee, which has been providing their oversight and governance since the 1990s and continues to operate today. We've had long-standing research relationships that have been established by our local research, First Nations local research team within FINISM, working well with research relationships, both locally, regionally, nationally, and internationally. And we also serve as a secretariat to our First Nations REB. And this has also been in response to the harms that have been done based on good intentions of researchers without First Nations, Métis, or Inuit people actually being at the table to tell our own story from our own perspective and worldview. Sometimes that leads to the misinterpretation and misguidance and results in harm. The health status, the health atlas that we worked with one another in partnership with the Manitoba Centre for Health Policy is really a demonstration of a true partnership between First Nations and allies like the Manitoba Centre for Health Policy, which Dr. Katz works with. We're able to collaborate on multiple research projects, including this one, which really speaks to, this is the front cover of our First Nations Children's Atlas, which really captures that worldview and understanding of connection and roles and responsibilities we have as women and families to that sacred being, that gift of life that we've all been given to take care of our children, and what those roles and responsibilities are and how we're working to shift outcomes in healthcare and well-being of our children through the reclamation of our ways of being and knowing and our medicines. So just give you another brief overview of our First Nations REB, the HERC committee. These are the 4 standards that HERC actually reviews research projects on, to ensure free, prior, informed consent on a collective and individual basis, to ensure that research abides by First Nations principles of OCAP, to ensure that we as First Nations have the ability to own, control, access, and physically possess our own information, because for far too long it's been held outside of our control, and often that often poses a risk of misuse and misinterpretation of that information. And also to ensure that within Manitoba we have 5 distinct nations each with their own ethical practices and protocols and ways of being. So just really recognizing the uniqueness of the various First Nations within our territories. And also to ensure that there's direct benefit to First Nations in agreeing to participate in research. Next slide. This kind of speaks to the overall national governance of information and data and the assertion of data sovereignty. I'm one of the 10 board members that sits nationally on a organization called the First Nations Information Governance Center, which is a data governance center that has been established nationally by Chiefs in Assembly and has been endorsed by First Nations across Canada, and really to provide space and to assert and provide governance over our own information. FNIGC was one of the first ones to really incorporate or advocate for the First Nations principles of OCAP.
So within the University of Manitoba, there was a recognition that we as an academic institution within an environment where we needed to recognize the sovereignty of First Nations, Métis and Inuit peoples, and their contribution to the world we live in and the lands we live on. And as a result, the university embarked on a partnership with FNISM to develop a framework for research engagement with First Nations, Métis and Inuit peoples that recognized, does recognize, not past tense, recognizes the ethical background that we need to abide by in doing research together in the future. So this was a bit of work that allowed us to explore how to do this in an ethical way. And as you can see from the quote in the middle of that slide, it's an opportunity to recognize and respect the work that's been done by Indigenous people in Manitoba for millennia, and to respect and recognize that and build our relationship based on that understanding, rather than a very paternalistic approach to research, which has been the norm in many environments, including our own, prior to the time that we started understanding this better and developed this framework, which was a key component of our ability to build on an initially established relationship.
So when we look at these principles, oftentimes they're tools to assert self-determination. They're tools to assert information governance. And depending on the infrastructure and resources available at the local community level, it's really about putting control or recognizing the self-determination of individual nations to really assert ownership control in whatever, based on their own direction. I'm not going to go into each and every one of those. You can read more on them after our presentation. And this really speaks to the other two principles of access and possession. One piece I will say is that it's really difficult to assert ownership, control, and access without physically possessing your own data. So that's why that possession piece actually becomes really key to asserting data sovereignty. Next slide.
And just to add from the perspective of the university is that we respect these principles, but we also recognize the reality that a center like the Manitoba Center for Health Policy, which has over 90 data sets, sometimes needs to, in a respectful way, have access to the data and potentially possession of the data to do those linkages as an interim measure while First Nations themselves establish the capacity to hold that data and do the research themselves.
And it is possible to ownership, control, access, and possession of information through information sharing agreements that have been signed between partners.
So just two contextual things to add as we finish off. The one is that within Canada, there's a Tri-Council ethics on research, which has a chapter devoted to First Nations, Inuit, and Métis people's research. We recognize that some of the requirements of the Tri-Council aren't yet up to date with the requirements that we in Manitoba currently apply. But it is the broader context that we need to recognize, as is the United Nations Declaration on the Rights of Indigenous People, which is an international agreement which Canada finally became a full supporter of in 2016. Thank you.
Thank you.